All right. Welcome, everyone. Welcome to the Health Behavior and Health Education Admitted Students event for 2021, which of course is being held virtual given all of our challenges with COVID-19. I'd like to introduce myself. I'm Brian Zickman Fisher. I am a professor in HBHE and the MPH admissions chair. So I have had the pleasure and opportunity to interact with many of your applications already and to be working with the admissions committee in admitting you. And I'm going to be sort of hosting today's session. I want to introduce a few other people who are going to be here and walk you through what we're going to be doing. Kieran, if you can progress to the next slide, I just want to take a start and just to set a little bit of session etiquette about the way we're going to make this work today. First of all, we ask that you keep your audio on mute. We're welcome to, if you want to share your camera, you're welcome to do so if you wish or not. But we ask that you keep your audio on mute until we get to the specified question and answer time. We really would like to share, if you would be comfortable sharing your video, just so that we can see you and build a little bit of rapport, but we also recognize that that's not always possible or appropriate in different situations. We are going to ask and encourage interaction using the chat box throughout this session. At any point in time, you can drop questions there, you can drop topics, requests for clarification. We'll be monitoring that on an ongoing basis. If we might interrupt the session, if something urgent needs to be addressed immediately, but we are going to reserve a major chunk of this first hour for a question and answer period, and we'll hope to get us to as many of questions as we can in that time, and we'll try and follow up with information if we need to. A recording will be available after today's session. You should all be have gotten that little warning message of this session is being recorded, etc. So that you can always go back and learn more from the recording if you need to. But we also want to have you direct individual questions to HBHE's graduate program coordinator, Jackie Cormany, and her email is provided here, jcormany@umich.edu. And as you will hear many of us in HBHE say, Jackie is the fountain of knowledge about HBHE's programs and student issues, et cetera. So she really can be a great resource for you if you have any kind of question. So I want to first also just do a little bit of introductions. So I mentioned I'm Brian, I'm a faculty member here. One of the things that we want to share with you today is a little bit about why we're so excited to be here in HBHE. And HBHE is a really unique place. We think it's a place that's not just a research. We care about research, we care about practice, we care about community, and you'll hear themes related to that throughout today. But one of the things that I really like about HBHE is its opportunity for interaction. I, as a researcher, get to interact not just with people within my department, but people throughout the campus. I have more collaborations with people in other schools and departments than I can honestly keep track of. And it's that ability to make connections that I think is one of the things that Michigan does really well, not just for faculty, but for students and for its alumni overall. And you'll hear more about that as we move forward. I also want to move forward and give you a little bit of overview of where we're going. So if you can go to the next slide. Yeah, so what we're going to do today here is first we're going to introduce you to a few people, and then I want to focus on the diversity of HBHE students. Hear a little bit from you. Who are you? Where do you think, what are you interested in? Where are you coming from? I happen to know many of those answers, having read many of your application packets, but I think you'll be interested in those answers as well. Then we're going to go through and do a fairly brief but comprehensive overview of both the curriculum within HBHE and also alumni and career-related issues, while holding a significant amount of time for questions. And then, as I think you know, we're going to reserve the second hour tonight, starting at 7 p.m. Eastern Time, for topical breakout sessions with faculty members. We've got multiple faculty members coming for that second hour, and we're really looking forward to the discussions that we're going to have there. While we're here, Jackie, if you could take a moment to introduce yourself.
Hi, everyone. I'm Jackie Cormany, and I think I've probably talked to a good number of you, either through email or Zoom, and maybe met you before in some of these other events. My main role is as the program coordinator for the department. So any kind of questions you have about, the requirements, or you want to get in touch with faculty or other people in other departments, actually. I've been here a long time, so I have a lot of connections. So please use me as a resource. I will be managing the chat with Brian tonight. And I guess what my question is, one thing that makes me excited to be here. Well, just to let you know, I've been at the university for over 35 years, 34 years in the School of Public Health, and the majority of that in HBHE. And one of the reasons that, one thing that I really love about HBHE is that they're just filled with really good people, just solid, good people doing really good things. And I can speak for the rest of the school too. This just filled with really good people. And that's why, that's why I've been here for so long. So welcome.
Thanks, Jackie. Next, I'd like to introduce Dr. Cleo Caldwell. Cleo is the chair of our department and a professor in HBHE. Cleo, would you share yourself and introduce yourself and tell the students a little bit about what makes you so happy to be here in HBHE?
Okay, so as Brian said, I'm Cleo Caldwell, chair of the department, and I've been here like Jackie for a very long time. And one of the things that I really enjoy about being here at HBHE is working with students. So let me start off by congratulating you on having been accepted into the HBHE programs, one of the best programs in the country. And that tells me that you are all superstars already. So we know you have choices in terms of where you may want to go. We hope you end up coming here to HBHE because, like Jackie says, we actually have a wonderful faculty, staff, and students that you will have an opportunity to engage with. So as I mentioned, the thing that I enjoy most is working with students, and I have the opportunity to work in a number of different capacities as the chair of the department, also in my classes, also on my research projects, and also through the activities that we do in the department where we have an opportunity to interact with each other. My big thing is that I learn a lot from students, that you are the ones that are bringing new and bright ideas to us. And it's one of the things that I find most satisfying in terms of you never stop learning. And I know that there's so many different things that I will be learning from you. So welcome, and we hope we'll be seeing you in the fall.
Thanks, Cleo. I also want to take a moment to let Professor Manal Patel introduce herself. Manal is an associate professor in the department and the associate chair.
Hi, everyone. Wonderful to see all of you here this evening. Congratulations on your admission. There was a time where I was choosing Michigan just like you, and I feel really fortunate that I made this decision. And why I did was because this is just such a supportive environment, and there's always just been this atmosphere of wanting everyone in the department to succeed. And I think everyone rallies around that. So I would say that's one of the highlights for me in terms of HBHE and being here. So welcome everyone, and looking forward to getting to know all of you.
Thanks, Manal. So now I'd like to know, you've gotten to know at least a few of us. I'd like to know a little bit more about you. So if you would use the chat box, and I'm going to pose a couple questions and just put in a couple word answers just to help us understand who's here with us today. So first question, where are you right now? Where are you? Charleston, South Carolina. Welcome. Asheville, North Carolina. I see some Missouri, Pittsburgh. Hey, I was in Pittsburgh for my graduate school. A lot of Midwesterns, Illinois, Maryland. Let's see, Maryland's not Midwestern, but welcome. Berkeley. A whole slew of people out in California. Windsor in Canada, welcome. And that's part of what we want to convey to you. Like we are a Michigan school, we are a state school, but we are a national school and an international school. We welcome students from all over the country, as well as all over the globe. And that's part of what we think is involved in being in public health, is recognizing that there's work to be done locally and work to be done globally. And you will certainly hear all of that kind of perspective from the faculty here and from the students here in terms of our interests. All right, so here's my next question for you. What populations do you most want to work with in your future career? Who do you want to be working with? Black women, excellent. Global, women and children, Pacific Islanders, older adults, low vision, folks with people with disabilities, LGBTQ, mothers and children, Latinx, young people, women, people of color. Like, all of those populations are populations who I can think of off the top of my head, where I could think of research projects, coursework, et cetera, that align with that. And you will see all of these kinds of populations as ones that your education here at the University of Michigan in the School of Public Health can help you to connect with, can help you to work more effectively with. And it's, again, that diversity of it is an unfortunate truth that there is a massive amount of need in the world for public health interventions, for public health research, et cetera. And there's plenty of work to go around, and we hope we can equip you to be ready to do that work. All right, one more question for you. What skill do you most hope to learn if you come here to HPHE? What are you most hoping to get out of your experience here? Are there particular skills that you know you need to do? Program development, absolutely. A big part of our core curriculum is about program development and program evaluation. What other skills? Community engagement, that's a huge part of our curriculum and a huge part of what we want you to be equipped to do. Interpersonal skills, communication skills, that's what my expertise is in communications and helping you craft messages that can be memorable and effective. Let's see, we've got educational outreach, community-based participatory research. How do we establish change? And change here can be local or systemic, and all of that needs to be brought into this. Effective policy making, statistical analysis. Again, sets of skills that are very much core to the full set of experiences you would get here in the Masters of Public Health program at Michigan. So what I hope you are getting from this is both that we believe we can help meet all of these needs. We can help you be ready to work with the populations you want to work with. We can help you develop the skills that you know you need to work with these populations, but also take a look at the diversity of perspectives here. Like, you're going to be able to mix with people who have passions about a variety of different public health topics and a desire to intervene, to desire to develop appropriate programs, appropriate research, to work collaboratively with different populations, et cetera. So all of that means I think you've made a great choice by applying here, and we'd like to convince you that this is the place you want to be. So with that as an introduction, let me now turn over the presentation today to one more faculty member, Allison Miller. Allison's an associate professor here in HPHE and the chair of the HPHE Curriculum Committee for the Masters of Public Health program. So Allison, if you'll take a moment, just a little bit of introduction, and then if you could give them the curriculum overview, that'd be great.
Sure thing. Thanks, Brian. Hi, everyone. It's nice to see you all. I will note to the Californians in the room, I'm also from California, and now I've lived in Michigan quite a long time, so it's doable. The weather's a little chilly at times, but I've grown to appreciate a lot about Michigan, and we'll just also echo everything people have said so far about the University of Michigan. It's such a rich environment, and I think that coming here and connecting with faculty just allows you to expand in directions you've not even thought of yet. And so again, I'd echo, I love learning from the students. I love being here. I love working with people who are really passionate and would like to change the world. And I really enjoy interacting with students in classes through research, and just the ways that you don't expect. And it's a really wonderful environment for all of that. So I'm here to share about the curriculum committee tonight, and I'll just say one word, which I think also reflects HPHE's kind of vibe, is that the curriculum committee is comprised of faculty and staff and also students, because it's really important for us to get student perspectives on how the curriculum is going, what they would suggest, different new courses that might be of interest and that kind of thing. So that's sort of important to just keep in mind as I run through a lot of kind of, somewhat dense details about what the curriculum looks like. So Kieran, are you the operator of slides? Or okay. Thank you. So first I'll talk about the requirements, the program requirements for the Masters in Public Health program. And these are at the school level. In this curriculum, we're really focused on some foundational competencies and also learning objectives that really culminate in your abilities to sort of know about public health, the meaning of different, pieces of the School of Public Health, and also to gather the skills that you need to really be an excellent practitioner in public health. Okay. We achieve this in a few different ways. So the core curriculum, these are courses that are offered at the school level. So these are courses that you'd be in with your cohort of students, not just HBHE, but all over the School of Public Health, which I think is a great way to kind of create connections among yourselves and bond and, get to know colleagues that you will have going forward. So this is kind of the way that kicks off. In the fall, there's a biostats course to get at some of the statistics someone put in the chat. And you'll notice also the sort of grayed out Public Health 507, that's social determinants of health and health communication. So there's a little HBHE exempt there, which means that you guys as HBHE students would actually take the HBHE versions of that content area. And so other students in the school would take the sort of broader school level course, and then you guys would do a deeper dive into those areas because those are sort of what HBHE does. So I'll talk more about HBHE's courses in those specific areas. We also, Public Health 512 is an epidemiology, again, very bread and butter public health course. 513, where you really figure out learning about health systems, connections between those systems, health policy as a public health course. And then in your second year, you would take Public Health 514, which is this public health sciences and the environment. So more of again, a broad perspective. 511, it's nutrition and public health, and that really covers program evaluation and program development. So again, you'll see that HBHE is exempt there, which means that you'll be taking the HBHE versions of that content area. And then also in the second year, the Public Health 516 focuses on leadership, interprofessional practice. So you really get to kind of put into play some of the skills that you've been gathering across your time in public health. Okay. Oh, yeah, I was like, wait, didn't we do this? But this is the HBHE program requirements. Okay, so within HBHE, this is just some information about the amount of credits. So it's a 60-hour program. People tend to take about 15 credit hours per term, and then half your credits are HBHE courses. You can do dual degrees that I believe either have been talked about or will be talked about at some point. But one thing to note is that there are many different dual degrees people can do. And so they're self-initiated dual degrees. So you could do urban planning, you could do social work. There's lots of different fields that public health connects to in really fascinating ways. And so students do all different kinds of things. And so if you're thinking about that, there's more information around dual degree pursuit. And definitely put questions on that in the chat as well. Okay, so here are the program requirements for within HBHE. So we have foundational competencies that we focus on in HBHE. The first kind of core course is the theory course. So we talk about HBHE 600, it's psychosocial factors and health-related behavior. So this is where you learn about, what do we know as a field? What has HBHE theory, meant so far, and how do we learn about different ways to think about behavior, what shapes behavior, what can change behavior, and someone mentioned multi-level interests, and sort of the idea of connecting individual behavior to social context is something we talk a lot about in HBHE. So this is where you sort of start to dive in. 651 is a program development course. And so that's where, again, you get to sort of apply a lot of skills and sort of think about, okay, how do we develop programs? How do we go about that? What do I need to do? What do I need to learn to go out and do this myself? So that's a core HBHE course that you take in the winter. 622 is kind of the corollary to that, right? So you need to develop a program and then you need to see how it works. And so that's our program evaluation course. In this course, you'll learn all about the methods and design and the strategies for evaluating whether your program works or not and how to tweak it to make it work better after the first time you do it. So that's the program evaluation course, and you take it in the fall of your second year. This is often after people have done an internship. And so there's sort of some recent lived experience that people can bring into the program evaluation course and reflect on how that relates to their internship as well, because that's a key part of our curriculum is the internship. And then HBHE 675 is our culminating seminar. And so we take that, you guys would take that in the fall of your second year, and that's related to, I think the essay's on the next page, right, Karen? But basically that's the opportunity to reflect again on coursework and internship and research and other experiences that you've had in your coursework so far, in your experience so far, and kind of bring it all together. Sorry, flip to the next one. So also a really important thing in HBHE is research methods and methods to study behavior and figure out what people are thinking and doing and why they're doing that. And so we have a lot of different research methods courses to choose from here. Survey research, behavioral research methods, GIS, which some of you may have heard of, but sort of mapping software to look at geographic patterns in health. We also have a qualitative methods course, an advanced quantitative methods course, and then a mixed methods course. And the reason that it's 7XX is that it's a newly developed course, so it'll be getting a course number soon. And yes, you could take more than one research methods course for sure. And the only requirement is that you take one. Most people take, I would say, more than one. We also have a health communication requirement. So this is, these are these three courses. So health communications for public health, materials and methods, and designing sticky communications for health advocacy, education, and mass media. So this is all about how do we get our good information that we know out there to people, and how do we make it stick? How do we make people listen and engage people in the process of health communication? So these are all really important skills that we value in HBHE. Oh yeah, we can share the slides. I know I'm talking fast. We also have a health equity requirement in HBHE. Again, this is just one course. Most people will probably end up taking more than one of these courses, but you can see here the range. So we look at history of health inequities and inequalities, community organization, an LGBTQ course, women's health, global public health. I don't need to read them all, but these are quite an impressive range of courses that people can really dive in and explore their interests. And again, the requirement is one, but most people will end up taking more than one. And I will also say that most courses in HBHE touch on aspects of health equity in examples and readings and just approach. So you will get that perspective no matter what in many of your courses. So that's all sort of the courses, the coursework. And there are other HBHE program requirements that are important to be aware of and think about. And one I mentioned briefly is the internship. So this is an opportunity students get to do typically between their first and second year, where you really get to go out. So you've had some coursework under your belt, maybe you come in with some experience. This is an opportunity to go and apply that experience in a new setting and working in the public health field as a professional. You can do research, you can do practice, you can do lots of different activities. If you just, if you talk to other students in HBHE, you'll see the broad and amazing range of the things that students do on internship. And the number of hours that you do for internship can also count as a credit reduction for your course load. And Kieran is the holder of a lot of this knowledge, so she can field more specific questions. I will say about internship, I am always just amazed at the richness and the range of student internship opportunities. Even during COVID, when people have had to be remote, it's been really impressive to see what people have been able to do on internship, and the information that they can kind of apply and learn has been really impressive and kind of heartwarming, I have to say, to see. Often related to internship is the applied practice experience, which we call APEX. And the idea here, APEX also meets some of these foundational competencies for public health programs. And usually, I say usually, it's connected to internship, because the goal of APEX is really to use these competencies to create a product that's sort of public facing or community organization facing. Whatever setting you're doing typically your internship in, you can create an APEX product that is useful to that setting, and it has you use the core skills that you've been acquiring through your coursework. And so it's a really great opportunity to develop products or work on a project that the program wants you to work on, and develop something new for them that they find useful. And you then have that product to sort of show in your portfolio of, this is what I did on my summer vacation in APEX. And then the culminating essay is what I mentioned with regard to the 675 course. This is the idea that you're writing in a thoughtful and integrated way around your experience, drawing on your experiences in the courses to really synthesize key areas of knowledge from your HBHE experience. And it applies to a public health issue, and it's a piece of writing that you can use as a writing sample, and it sort of shows off your problem solving skills, because you'll basically be giving recommendations as if you were writing something for a public health audience, like a health department or something like that. So this is this idea of a culminating essay. You're drawing from a lot of your different coursework and skills, and then you're creating this writing sample that is useful in the future. Okay, this is small to me, but the recommended course sequences here, I mentioned, you typically take this in the fall or in the winter. You can kind of see on here where the different courses line up that I was talking through. I guess I'd also just highlight, there are a lot of different places you can take electives. And so HBHE is really kind of known for having a lot of elective options. And so students are able to take a lot of classes that didn't even appear on these slides that are available in HBHE. And so just keep that in mind. It's a really great way to sort of craft your educational experience the way you would like it to be. So you can do deep dives in topics and courses that are of interest to you. And then this is just a good general guidance. Plan ahead. Know, if you desperately want to take a single course, make sure that that course is going to be offered in the semester that is available to take it. And you can talk to people in the department. People are happy to share this information. And so just, be aware and plan ahead. Special topics and new courses are often offered, and that's sort of when the student input to the curriculum committee can be really helpful. And just keep in mind that half of your credits need to be in HBHE courses. And the certificate programs, am I talking about? Okay, I can talk about this. Certificate programs are, again, the sort of way to tailor your experience around your interests. And so there, you can see, I don't need to read them all off, but there are a number of different certificate programs just across the School of Public Health. that allow you to, sort of show you have a particular interest in this area. Like, I really am interested in sustainable food systems. So I'm taking additional coursework in that area, and I'm going to gather enough credits so that I get a certificate in that area that can appear on my transcript. So there's, as you can see, just from that range of activities or topics, there's a lot of different options to choose from there. Sorry if that's a little fast. I know we want to have time to chat. Thanks.
Thank you, Allison. Yeah, there's a lot of information there, and the chat has been very busy with additional questions and comments. Obviously, we'll try and get into a lot of that in the Q&A session. But first, let's take a few moments and have Kieran Zakaris introduce herself and also talk with you about HBI alumni and careers.
Thanks, Brian, and good evening, everyone. Congratulations on your admission to the department. I'm Kieran Zakaris. I work in the Office of Foundational Learning and Practice in the department, and I'll talk about that in a moment. Just want to kind of do the similar introduction. I've worked as others and similar themes as others as well. I've been in this school for a little over 10 years now, and I've worked in HBHE about 6 of those. And what keeps me excited about this work is the people in the department, in the school. Particularly, I really enjoy working with students, getting to know your interests and your passions. And I also love that in our department, we can have really honest and sometimes maybe often challenging conversations about public health issues, about what's going on in the world, and how our field impacts those issues, how we can think differently, better, in more innovative ways to address those issues. So I appreciate you being here, and I hope we can engage in those conversations together starting this fall. So the main way that I work with students, as I mentioned, is through the Office of Foundational Learning and Practice. We are a resource in the department that focuses on the curriculum requirements around practice, around the competency-based requirements around practice, as well as that culminating essay or integrative learning experience that's part of the program. And I work closely with Bill Lopez, who's a clinical assistant professor in the department. If you have more specific questions about requirements for internships, I think we'll touch on that in Q&A. Also, my email is here. Me and Bill are happy to chat with you about examples of current student experiences, connect you with current students, share abstracts or posters from past internships. So please don't hesitate to reach out. We can definitely set up a conversation. Another hat I wear in the department is alumni engagement. And this often also ties into career resources and support. So you can find career placement statistics on the website. I'm going to drop some links and resources into the chat shortly. One of those is where you can find this handout, as well as going a couple of years back. So, highlights here, right? We have strong job placement. We have high levels of satisfaction of our recent graduates in the careers and the work they're going into. And we have really diverse employment by sector, which I know this is really small. So again, I'll share this handout with you so you can zoom in on some of those logos and the sectors where people are working. Job titles range from, coordinator, analyst, specialist to consultant, manager, co-founder, or CEO, right? There's a huge diversity and array of things our graduates do. And I have more attachments I'll drop in the chat that have employers going back 3 years and some sample job titles, just to give you more context there. Another key point I want to make is that there's just a wealth of resources here at the University of Michigan for internship and job searches. So our department partners really closely with the school level career development team, who I believe you've heard from. We collect and share postings for opportunities. We bring alumni and corporate recruiters to the school. Coffee chats and networking events happen, virtually or in person, again, depending on where the company is located. And we have a very robust internal job posting site at the school managed by the careers team, the careers portal. And so students and alumni both use that for internships, jobs, and project-based work as well. And you also have access to university-wide resources. So there's a Handshake site. There are university global career nights or different career recruiters, again, that come at the school and university level that you have access to. And I can't underemphasize the strength of our alumni network and how much of a resource that is. So, when you come to Michigan, you'll join our network of over 1,600 HBHE alum and 16,000 SPH alum. And not to mention that the University of Michigan claims one of the largest living alumni networks in the world. I'm an alum myself, so I might be a little bit biased, but I've found that our alumni from our department are just extremely committed to supporting students in the program, to supporting each other. If you're a U of M undergrad, you've probably experienced this already. A great place to explore our alumni network further is our SPH LinkedIn page. And I'm gonna, again, drop a link in the chat in a minute that covers, there's a section where you can look at sort of like where members of that group are, and some profiles will appear for you to check out. There's also a lot of great features on the SPH website that are like articles written about alumni, and some of them have been featured in the recent podcast episodes. So again, I'm going to share some links to those things in the chat, so you can check all of those things out. And of course, contact me if you have additional questions. Our alumni also are happy often to speak with prospective and admitted and current students as well. A couple of other alumni resources include the fact that our alumni share jobs they share jobs with the department. They share jobs. We have a listserv that we use where we share postings out to alumni and current students, and jobs and internships. This is a huge, really robust resource. We also have an alumni platform internal to the school called Michigan Public Health Connect, which involves, it's kind of like LinkedIn, but you don't have to, there's no awkwardness. Everyone has already agreed to connect with you, so you can message and set up meetings. You can also participate in a mentoring program through that platform. And finally, we have an alumni engagement committee, and we try and organize networking and like Zoom career spotlights throughout the year. So you won't be alone. What they say, wherever you go, go blue. And if you join our department, you will experience that really unique aspect of Michigan. So I'm going to turn it back over to Brian to kind of manage Q&A via the chat and via your input. So thank you.
Great. Thank you very much, Karen. As Karen mentioned, we've got about 16, 17 minutes before we want to take a very short break and get set up for our breakout rooms. Please use the chat. We've been trying to answer a lot of questions already in the chat, but please use the chat to post any further questions, or if there's something that you want further follow-up on. And I will MC and refer questions to Cleo, to Jackie, et cetera, as needed. So let me just quickly, I'll read off things and keep posting stuff. Average number of students per MPH class. It really does vary a lot. I mean, the foundational public health curriculum, obviously, are larger courses because they're for students in multiple departments. Within HBHE, some classes can be quite small. Some classes can be somewhat larger. I will say my communications courses, which tend to be on the larger size, I've got a class of about 30 right now, but we maintain a lot of individual connection. Let's see, what does a typical week look like for a student? Is it possible to commute from the Metro Detroit area? I think the answer to the last part is yes, because I know students who have done that, especially given that you have some significant choice in your course scheduling. I know some people who've either chosen or not chosen early morning classes to avoid the traffic issues. Let's see. Can you speak about instruction setting for fall 2021? So we are learning guidance on this as we speak. Like the university has set a goal of having most classes, including all the predominantly smaller classes, to be in person, with some larger classes still maintaining hybrid. I would say that's a moving target. We are learning that about what the school's plan will be and which courses will be maintained online, but it's certainly our intent, given assumptions of available vaccine to everyone who wants it by the time the fall starts, and no, obviously, sudden changes in the public health situation, for that to be the way in which the instruction will be delivered. I'm just jumping forward here. Jackie, if there's ones you want me to particularly respond to, let me flag them for me. Alumni go everywhere. Some stay in Ann Arbor. Some people move to other areas of the state, everywhere. Michigan alumni go everywhere. I think that's the simple answer to that one.
Brian, I think a lot of people are asking about dual degrees, how that works.
Yep. Kieran, I think you've got a window that's showing up in the slide here. Dual degrees are essentially a self-initiated process. Like you have to complete 45 credits instead of 60. But you do have to meet all of the requirements. Now, because HBHE has so much elective space, you can meet all of those requirements and still take some electives that are focused for your HBHE or for your public health degree. How that works for different programs depends a lot on what the program is. Some students, many students will take a sort of like 1 year for one degree, another year for the other degree, and then the last year is more of a hybrid to fill stuff in. That's especially true when there are sort of cohort requirements that really means you've got to stay focused in one school. But it does vary from one program to another, how that works. The main thing is to really sort of come to understand what the requirements are in each program, and then just to start to lay that out. And Jackie and your HBHE advisors can help to some degree with that, but it is a self-initiated process. We do not walk people through a particular prescribed pathway for most of the dual degrees. Very small exceptions to that. And even there's because of the electives, there's a lot of flexibility even built in for those kinds of situations.
I know this is going to come up about residency, Michigan residency. So can I jump into that one real quick? I want to say that if you have never lived in Michigan ever, the chances of you becoming a Michigan resident and receiving in-state tuition is really non-existent. If you were in Michigan and you ever left the state to do some other kind of experience or a job, you'll notice that your residency will be questioned. So please fill out that petition that the residency office has, because without it, you will not be considered a Michigan resident. So that process takes a while. So please try to jump on that right away.
Let me hit a couple other ones quickly. So the internship credit reduction. So what that means here is the degree is a 60 credit hour requirement, but you don't get a credit for doing your internship. What you get is that 60 knocked down to 57 or 56 or 55, depending upon how much time you put into your internship experience. So that means you can still take more courses since you're a full-time student, but it means that you don't have to take the full 60 credit hours of instruction because of that reduction. And it just depends upon how many hours you then do in your internship experience. And one other quick one that I see here is it typical for students to have part-time jobs while taking classes. I can't say for every student, but certainly many students I know are having part-time jobs. Some of them are internal to the university, like students working part-time on various research projects. Some of them are in other units on campus, and some of them are external, but that's certainly not uncommon. Let's see, what else is here?
Did you talk about jobs?
Can you read? I'm trying to catch up here. What are you focusing on? Kieran, you've got the job titles there. So is there a website where scholarships are posted that we can apply to? So the HBHE scholarships are done as part of the general application process. That's still an ongoing one. I'm not sure. Jackie, is there a specific other place that we guide people to look for other scholarships on campus?
We do. There is a scholarships page on the school's website under funding and financial aid. And also, I want you to take a special notice of the Michigan Library. They have put together a database that is searchable, that's specific for public health students. So when you get to that page, I don't know, I'll put it in the chat if somebody else hasn't yet. There's links to many different outside sources. One thing I want to note that some people might have found the Rackham Graduate School in some of the funding opportunities available there. Just know that you're not considered a Rackham student, so because we are a professional school. So many of the opportunities you will not qualify for, unfortunately.
I see a couple of questions here about how to find research or teaching assistant positions or job opportunities. So one of the general things that I'll say is, I mean, there are posted positions, but a lot of this happens through students reaching out to faculty or research centers that they're interested in and saying, hey, you're doing interesting stuff, and is there any opportunities? And the answer isn't always yes, but sometimes it is. And many times students are then able to participate in whatever the activities are of that center or of that research team or of that professor and become part of that process. Certainly, we encourage you to be relatively active in reaching out to people on this campus who you see is doing interesting work, whether that's within the School of Public Health and within our department or outside that. Certainly, we've had, I have more personally connections with people in the medical school because of the work that I do, and I know students who reached out to particular organizations interested in, say, health communications programs, did their internship, found their internship through that process, and then ultimately went to work there after they graduated because they built that relationship. So it's a fairly open atmosphere here for students to be reaching out to groups that they find interesting. What else here? So I see a comment here about summer. Pretty much there are not courses for most students taking public health programs during the summer. Like our structure here is that the primary courses are going to be during the fall and the winter terms. Here, for those of you not at Michigan, you may be thinking, what about spring? Well, what I normally thought of as the spring semester here is the winter here. And during the summer, students are primarily focused on the internship experiences or other, applied contexts. Right, so that's what Jackie is reinforcing here. But I want to reiterate, you have a lot of elective space, and the primarily way that people, if they want to pursue a certificate, is just by being sort of intentional about using their electives to meet the needs of their certificate program as they go through the regular semesters. Let's see what other stuff. Jackie, anything you want to say about the financial aid question?
Yeah, what I was just responding to Jenny that I believe if you filled out the FAFSA, they are packaging incoming students now. Returning students will be next month, but that you should be hearing something soon if you've submitted it earlier.
How common is it to do an internship abroad? Well, I have a simple answer and then a complicated answer. The simple answer is certainly plenty of HVHE students do. I'm not sure I could say an exact proportion, and obviously last year was complicated with COVID and a lot, of course, everything got shut down. I don't think it's a majority, but it's certainly a strong minority. I would, if I had to make a guess, I would say something like a third might do an internship abroad. Maybe that's not quite right, but certainly every year there are a significant number of students who are doing internships abroad in a variety of contexts, as well as certainly internships being done not just locally, but throughout the US. Are there any, hold on. You're sending out the swag bags. I don't have that answer. Let's see, what else are here? Apologies, we're sort of running, doing this on the fly, but I'm trying to be as flexible as we can to respond to your questions.
I'll just pop in and answer a little like about the global internships. It's been anywhere from like 18 to 25% maybe of students that have gone abroad. And I see Maya has also asked, is there support in finding internships? And there is, myself and Bill in our office, we do a lot of outreach to partners in creating internships or just connecting students with organizations they're interested in. A lot of students develop their own internships. So often it's very student initiated based on your interests. There's also that posting site I mentioned where lots of organizations just post things that they think might be relevant. And of course, faculty are a huge asset in students identifying internships. And we have an Office of Global Public Health at the school. So for global internships, there are partnerships and advice and guidance through that office as well.
I'll also add to what Kieran just said, another major pathway for internships, and I think I put something in the chat in earlier, is following previous students or alumni's footsteps. We definitely have had, one of the things that we do is we have second year students share their internship experiences with first year students, and it is by no means unusual for people to say, hey, wait a second, that's a really good idea. Maybe I'll want to go there next year. And you can look back to previous years. I've certainly had employers come back to us sometimes and said, keep sending us. We're more than happy to have this pipeline of bright HBHE students coming to us. So that's another key pathway here. All right. Any last one or two questions before we take a brief break and set up our breakout sessions? While anybody's thinking if they have a last question, I will reiterate the session's being recorded. We'll make it available to you. Please don't hesitate to reach out to myself, to Jackie, to Kieran, to any of the faculty here. If you have specific questions, we'd be happy to try and work with you. We recognize, obviously, we can't cover everything in a quick Zoom session, and that some of these questions are legitimately things that need to be worked out student by student. Certainly many of the dual degree questions that we've been talking about, it's different if you're thinking about urban planning versus social work versus genetic counseling, et cetera. And we need to help you think through what the differences are in those different situations. And all right. So the plan for right now is we're going to take a 5-minute, bio break, stretch your legs, etc. We will reconvene right at 7. We've got multiple faculty joining us if they're not already here. I haven't been watching the participants list. And what we'll be doing is we'll be setting up 2 sets of faculty breakout rooms. So there'll be a 25-minute session with 3 different topics, and you can join in whichever one you want to and just hear some faculty talking about that issue and hopefully engaging you in conversations about this. This isn't going to be sort of faculty just talking about their own work, although obviously they'll share some things, but really getting into talking about sort of like, what are the issues? What do we want? What do we need to do as a field? What's the exciting stuff that's happening or needs to happen? And we can hope we can engage you as a participant in that process. So I'll give you a break and we will see you in about 4 minutes and get that process started. All right, I think everybody is back now. Thanks to everyone for attending this. Thanks to my fellow faculty members and to Jackie and Kieran for providing all the support for this event. I'm glad Jackie's got this final slide up here. Please, if you have any more questions, Jackie is the point of first contact about how the program works, about connecting you with faculty, about connecting you with students. And we would very much like to hear from you. I've been saying this in our breakout rooms. Please do consider reaching out to faculty members if they were here, you saw something interesting, or if you just look them up and you say, hey, that's really cool work, I'd like to learn more. We'd love to talk to you. And thank you for choosing U of M as a school that you're considering. We'd love to have you this fall. We hope we can meet your needs as you think about your careers moving forward. And it's great to see you. So thanks so much, and we're looking forward to seeing you and hearing from you more moving forward.
Thanks, everyone. Bye-bye.
Bye-bye. Thanks, everybody.
Thanks, y'all.